All employers need to consider how best to decrease the spread of COVID-19 or any communicable illness and lower the impact in the workplace. This is the second of a 4-part series that includes a short overview of things to consider when getting workers back to the workplace during a pandemic. In this segment, we will discuss maintaining healthy business operations. We come right back.
Welcome to this episode of Workplace Health, Improving Employee Health and Productivity, with President of Workplace Health, Inc., Shanna Dunbar.
How do we maintain healthy business operations during a pandemic when several employees may be affected by the disease? We use the same principles for emergency planning for any unexpected event. It is imperative to consider all aspects of your operation. Please find the previous episode we did on maintaining your business following any kind of natural or unplanned disaster for more information. We are recommending the following to all of our clients as they return employees to the workplace during the current crisis with COVID or frankly any pandemic. 1, appoint a workplace coordinator. There needs to be a point person on your team. This person does not need to be responsible for making all the decisions. Your operations and leadership team need to do that. But the coordinator can be the person to be sure the communications of the policy updates get out into the workforce in a timely manner. 2, review your sick leave policies and see where you can be flexible in terms of allowing absences for illness. You need to outline when it is considered safe for an employee to return to work following an illness. Will you be requiring a doctor's excuse? What if the person cannot get one? How long should an ill employee be off work following COVID? Right now, the CDC website has great guidance on this for you. And of course, you can ask your occupational health professional to help you with this idea. When you are making adjustments to any of your policies and procedures, be sure to clearly and frequently communicate. Paper postings throughout your building, or an intranet posting, a notice mailed to your employees' homes, and a notice through the department managers can all help get the word out to all your workforce. It is also suggested to think about how you will maintain business operations should you have a spike in absences. We know in public health that pandemics happen in about a 10-year cycle. So even if we do not see a spike with this particular coronavirus, we should have a tabletop discussion for emergency planning should it occur in the future. Make sure you have clear policies about social distancing at 6 feet. The theory here is that because COVID spreads through respiratory droplets, like frankly any flu virus, keeping distance while interacting with others will reduce the likelihood of transmission. Remember, diseases spread through close and prolonged contact, not casual contact. In other words, just walking past a coworker is not likely to transmit the disease, but working closely together for a longer period of time without a cloth covering could. Cloth face coverings will also contain the spread. The concept is that when a person wears a cloth covering, they're reducing the spread when they talk, cough, or sneeze. As we know, in healthcare settings, a surgical mask or N95 type respirator is used to protect the worker from getting exposed. That wraps up part 2 of this series on maintaining business operations during a pandemic. As a review, 1, assign a coordinator. 2, review your policies. 3, clearly communicate any updates. And 4, consider how to maintain business operations when there may be a spike in illnesses and absences. We will be posting the last segments of this series shortly. Again, feel free to contact our office if you have any questions about keeping your workers safe, healthy, and productive in the workplace. We're happy to answer your questions. Now go make it a great day.
Thank you for watching Workplace Health. For more great information, visit www.workplacehealthinc.com.